lot of people, cause I've been a lot of places. Might forget a name, but I don't forget faces. My game been tight for
what's going on, world? You're rocking with the young man Nuke, and this is Fresh Radio, where I bring you the family revolution, edutainment, spirituality, health, and hip-hop all in one show. Yes, today is Thursday, and I am going to speak on this episode. I'm going to speak on the different types of enrollments. Now, if you listen to the previous Thursdays or the previous shows, you know that I was talking about the in-network, out-of-network, and the HMOs and PPOs and EPOs, and I even went off into how premiums, deductibles, co-payments, co-insurances, and those maximum out-of-pockets work. I am going to step aside from the health insurance lingo, if you will, and then go into talking about the open enrollment periods and how you can get insurance. A lot of people don't understand that, you can't get some types of insurance you can't get throughout the whole entire year. So with this one, I'm going to go in. I'm just going to let y'all know about the open enrollment period, the annual enrollment period, and special enrollment periods, okay? So bear with me. So when it comes to obtaining insurance, truly, there's certain times of the year that you can actually get coverage, and it depends on your age too as well. A lot of people get some of these things confused, so I'm here to break it down for you. The open enrollment period, and this is the major one. This is for the Affordable Care Act, ACA, Obamacare, you dig? The open enrollment period is once per year, typically between November 1st and December 15th. However, there are some states that allow it to go to January 15th. When you sign up between November and December, your plan will start January. If you sign up in January, your plan will start in February. Okay? Now, I probably have to do a whole show on ACA, Affordable Care Act, just to break it down, because there are people who still calling it Obamacare, and it is not Obamacare. Obamacare doesn't even exist, okay? Just letting you know that. But outside of that date, November 1st through January 15th, you're going to need what is called a special enrollment, okay? And a lot of people don't understand that. A lot of people just think that you can just get health coverage anytime that you want to. And while that may be the case, the one thing that makes the ACA, Affordable Care Act, so dope is that it covers pre-existing health conditions, whatever that may be. If you had stitches in your finger and you got the stitches when you had health care and you lost your health care, some coverages will not cover taking the stitches out because it is a pre-existing health condition. Just using that as an example, like COPD, with a chronic obstructive pulmonary disease. I think that's what it is. That is a respiratory thing that a lot of smokers get. If you have that, you would need to be on the Affordable Care Act. If not, then yeah, you probably wouldn't get coverage. And that's a shame. And we'll talk about that a little bit later, I guess. Maybe not in this episode, but yeah. So outside of that November 1st through December 15th, January 15th, depending on your state, you would need that special enrollment period. Now, special enrollment period is for anyone who has a life change. So what they call QLE, qualifying life event. qualifying life event would give you a special enrollment period. The special enrollment period lasts 60 days from the time of your qualifying life event. Okay? Now, you can sign up anytime during that 60 days. If you had one of these events, you could sign up on the 59th day or the 60th day, but the 61st day, you're just screwed. So one of these these qualifying life events, and these are the major ones, you can lose health coverage due to no fault of your own, have a child, like give birth to a child, and if you are the mother or the father, as long as you are jointly living in the same household, you would qualify for that event. Adopting a child, same thing. Getting married, getting divorced, being released from incarceration, having a change of income, or moving out of your service area. Those would be your special or your qualifying life events to give you a special enrollment period. So, I mean, if you want me to, I can go in further deeper on those topics and things like that. You know, just drop a comment, get in contact with me, and I can do that for you. But having that special enrollment period will allow you to enroll anytime after January 15th, as long as it's happened within the last 60 days. Okay. You can get pregnant January 15th, and you would have to wait the 9 months. So your pregnancy doesn't count, which is unfortunate. A lot of, actually Kentucky, I just learned this. Kentucky allows pregnancy to be a special enrollment period. So go figure. That's one of the only states that allows that, though, out of all 51, 52, however many it is now. So, yeah. The last one I want to talk about is the annual enrollment period. The annual enrollment period is for Medicare users. Okay. The next show, I'm going to actually talk about Medicare and Medicaid. I do not sell Medicaid, but I feel it's important that I do a show just on the distinction of those. Now, the annual enrollment period is from October 15th to December 7th every year. And during that time, you can either join a Medicare plan, you can drop a Medicare coverage to switch to something else, Medicare Advantage, prescription drug, Medigap. Those would be for people who are 65 and up or have been disabled for 2 years or more. So, I mean, that's the main difference, Outside of those particular things, you might want to look into some short-term medical where you can sign up anytime that you need to. Like I said, short-term medical, it does not cover pre-existing health conditions, and it is only good for a short period of time, whether it be a month, whether it be 9 months. Some short-term medical can go up to 3 years, but the main thing is you're not going to have this coverage for the rest of your life. It's going to end at some point, and after it ends, you'll have to renew, and you usually renew for a higher price. So, yeah, if you got any questions about any of these things I just went over, please give me a holler, shoot me a comment, DM me on anywhere that you can find me. You can find me on nuknoe.com or nuknoe.link. All of my social medias are there. Yeah, I am actually in the midst of creating a ebook with all of this information in there, so that you can just have for your own sake, and call it a reference, call it a health reference. You dig? But yeah, anything else, man, let me know, man. I'm here for you. Man, I appreciate y'all listening to the Young Man Nuke here on Fresh Radio. We will bring you the family revolution, edutainment, spirituality, health, hip-hop. All in one show. Y'all be smooth.
Yeah.
Peace.
Hey. I know a lot of people cause I've been a lot of places. Might forget a name, but I don't forget faces. My game been tight for a quarter century. Cause I still speak to people that I met in elementary.